if we want to switch gears just a little bit to speak a little bit more broadly about the virtual sessions this year. I think it kind of alludes to a greater discussion about, what exactly the future of our practices look like. What exactly will ophthalmology look like if, we find out that this is running smoothly in terms of it being more virtual based, more telemedicine heavy. Of course, some third party players have kind of come into a role where it's been more greatly embraced during the pandemic, right? And I just wanted to kind of tap into you and ask exactly, Dr. Clark, what have those changes looked like in the ophthalmology space? And to your perspective, how's it been going?
Well, in terms of clinical practice, I don't really see that technology has helped us too much. I don't think we're quite there in terms of really effective telemedicine platforms. I think as we see devices such as home OCT and other sort of diagnostic devices like that that really penetrate the market and are available to patients, we will be able to monitor them more remotely. But as it stands today, I don't think that the pandemic has changed much in terms of clinical practice. We'll see how that plays out in the coming months and years. But I suspect through this crisis, I think it'll pretty much be business as usual in terms of taking care of patients. The meetings have been an interesting situation. It's been interesting to see the creativity in the space and how different sponsors have done this in different ways. And some of the smaller meetings have been very creative, very entertaining, and they've been a lot of fun to participate in. And quite frankly, it's easier to participate in more meetings because you can do it at home.
Yeah.
And I think there's been some appetite to get online to see our colleagues because we are, as a specialty, we are used to meeting a lot and we're used to seeing our colleagues. And so there's been a real sort of desire to reconnect. I know certainly for me, that's the case. And I know many of my colleagues as well. I think we all hope that this crisis will run its course in a fairly timely manner, and then we can get back to seeing each other on a regular basis because our field is very social or collegial, depending on how you look at it. But certainly it's a very cohesive group of people. And I miss seeing my friends in retina and look forward to getting back together real soon.
Yeah, I think that's certainly one of the greater benefits I've seen in the ophthalmology space in covering it is that it seems like such a tight knit community. Every interview, alludes to someone else that I'm probably interviewing that day, especially at a conference. Everyone knows each other very well and each other's work and complements it as they're going in terms of improving upon it by collaborating. So I certainly hope for that for you guys too. And I miss the conference hall floors too. So this is how we got to do ASRS this year. So be it. But thank you for that input and, the perspective on how the field's been going. And just curious, Dr. Clark, is there anything else you want to talk about in terms of aflibercept, Panorama, ASRS, anything else going on?
No, I think that's probably it. I think we're good.